Okay, so we are just at 11 o'clock, and I know that this presentation does tend to take the full hour, so we're going to go ahead and get started. First, good morning, and thank you all for joining us. This is VLP's webinar focus for October is Medicare, and because there is so much to learn about Medicare, we actually have two Medicare webinars this month. Today, our speaker will talk about Medicare basics, and then on the 18th, she'll focus on Medicare's annual enrollment period. For those of you that don't know me, my name is Sarah Avila, and I'm a financial advisor here at VLP. If you are attending one of our webinars for the first time, welcome, and thank you for joining us. For those returning, welcome back, and thank you for your continued trust in our firm. VLP is a financial planning and wealth management firm located in Vienna, Virginia, and we work with clients nationwide. Our goal is to be a trusted partner to the individuals, families, and businesses that we serve. In the last 25 years, we've grown from a two-person firm to a team of 18, which includes 7 certified financial planners, 5 accredited investment fiduciaries, 2 chartered financial analysts, and a certified divorce financial analyst. Today, our advisors have a collective experience of over 100 years, and we celebrate being recognized by the Washingtonian and Northern Virginia Magazine as top advisors, an honor we've held for over a decade. We are excited to be joined by today's presenter, Emily O'Halloran. Emily is the executive director at MP Group. Formerly, they were called Medicare Portal. Prior to finding her mission in Medicare, Emily spent years educating and training individuals and communities on how to understand and access other government programs. Today, applying this experience, Emily and her team of licensed insurance agents collaborate to develop a positive Medicare enrollment experience for their clients and to maintain those relationships over time as their clients' Medicare needs evolve. So just a few housekeeping items before we get started. We ask that you keep your lines muted and your videos off during the presentation. The presentation will last about an hour, and then there are a couple of breaks built into the presentation for questions. We typically do have a little bit of time at the end for questions as well. You can ask your questions by typing the question into the chat box to be addressed by Emily during those breaks. At the end of the presentation, there's some time for additional questions. That would be a time, if you prefer to unmute your line, that would be the time to do it, is at the end of the presentation. Or you can always go ahead and type that question in the chat box as well to be addressed by Emily. All right, well, at this time, I will turn the presentation over to our speaker, Emily O'Halloran. Emily, please go ahead.
Thank you so much, Sarah. Let me get my screen up. All right. Thank you so much for having me today. I always enjoy talking about Medicare, as you guys know, and I especially love working with the team at VLP and your clients. I recognize a few names and certainly may have some folks here who are not new to Medicare, as well as some who are. So for those of you for whom this is a little bit of a refresher, hopefully that will meet that need to kind of remind yourself some of these basics about Medicare, but we'll also duck into some details. And as Sarah said, in a couple more weeks, we're going to have another presentation that's more focused on the annual enrollment period that is just getting ready to get going. So as Sarah said, I really love doing what I do. I love teaching people about Medicare, and I'm coming up on 5 years doing that. That's my family on the right. I really like this so much that 2 of my kids have joined our team. So my daughter on the right is an intern with our company now, and my son Riley on the right is an agent coming up on 3 years with the team in the Charlotte area. So it's a little bit of a family affair. So Medicare portal, as Sarah mentioned, we just in the last couple of days have had a name change to come up to speed with some recent changes in Medicare law. So we had to take the word Medicare out of our name. But we're still the same organization. We are Medicare Portal MP Group now, and we are based in Tyson's Corner. We're an independent Medicare insurance agency, and we provide no-cost education, enrollment, and lifetime support to current and future Medicare beneficiaries. So still doing the same thing, just a name change to take the word Medicare out of our name and always stay compliant with the latest Medicare rules, of which there are many. So we describe our process of working with our clients using the acronym PATH. So first, our focus is to prepare folks for Medicare if they're new to Medicare. Then we help with the application process, whether it's applying for parts of Medicare through Social Security, which we'll talk about in just a moment. Then teaching you how Medicare works. So that's a lot of troubleshooting as things come up, explaining how Medicare benefits and different Medicare plans are going to work different than or differently than plans that people have had in the past, and then helping along the way. So there's always something changing. There's always something that is, maybe a little confusing, and we do what we can do to try to help smooth that process as people transition over to Medicare. But even years later, as things occur down the road, we want to be the resource to help make it easier, make Medicare less stressful. So these are the states where our team members are currently licensed. This map changes pretty rapidly. We're growing a lot as well, adding lots of new agents to our team. And as of right now, you can see where we are licensed to serve Medicare beneficiaries. Now, if you're here today, it may be because you are getting ready to be one of the 10,000 Americans turning 65 each day. It's actually more than 10,000 now. So this is obviously a rapidly growing segment of our population, and Medicare at some point is going to affect everyone, whether you start Medicare at age 65 or whether you push that off a little while, and we will address that difference in enrollment time periods as we move along today. But, if you are here because Medicare is confusing, even if you've been on Medicare for a while, you are absolutely not alone. I don't think I've ever met someone who doesn't work with Medicare on a regular basis who isn't confused by it. So if you take nothing else away from today, just know that you're not alone. It is a little bit of a complicated system, and that's why we focus on it exclusively. So what we're going to cover today, first of all, just, fundamentally, what is Medicare? How do you wrap your head around what the program is, what it does? And who is eligible, which is pretty straightforward. And then what your options are. And that's a little bit less straightforward, but we're going to break that down into two main options into which pretty much everyone's choices will fall. Then we are going to talk about when you enroll, which, as I mentioned, can be different for different people with different circumstances. We're going to talk about some of the basics of what Medicare costs and some of the costs that can be variable that you'll want to be watching out for and also assessing as time moves on. And then what help is available. So we'll touch on that as we wrap up. Make sure you know where to find us and how to reach out to us, especially in the months ahead with the upcoming enrollment period. All right, so what is Medicare? Well, we'll start there. Often people are just, it's a vague term that until you're approaching eligibility, you don't really know where Medicare falls in the grand scheme of things. It is a federal program. So Medicare is exclusively a federal program administered by what's called CMS, which is the Centers for Medicare and Medicaid Services. And CMS falls under Social Security. So Social Security, think of as your gatekeeper into enrollment in Medicare. When it is your time to enroll in Medicare, you'll start by enrolling through Social Security. They manage your eligibility for Medicare. And what does Medicare do? Well, Medicare offers health insurance to American seniors and some other eligible individuals. So not to be confused with Medicaid, which is a federal and state partnership and can differ and does differ from state to state. Medicaid serves low-income individuals. Medicare is for American seniors and other eligible folks of all income levels. Started in 1965, took effect in 1966, so we're at almost 6 decades of this program as a federal program, and layering year after year. New legislation changes it, and every time it changes but isn't completely revamped, you get this layering of complication, and that's really what has caused it to be so just perplexing for a lot of people. But breaking it down to its most basic parts, it did begin with 2 parts that are referred to as Original Medicare, often seen abbreviated as OM. And Original Medicare is just Part A and Part B, which still do exclusively fall under CMS, which is under Social Security. So they're totally federal health insurance, Part A and Part B. Now, private insurance was added to the mix with Parts C in 1997 and Part D in 2006. And we're going to get into more on what each of those parts looks like as we move along. So who is eligible for Medicare? As I said, it's pretty straightforward. You must be a citizen or legal resident. And legal residents must live in the U.S. at the time of their enrollment and have lived in the United States for the last 5 years prior to applying for Medicare. You must also meet one of the other requirements, such as being 65 or older, or if you're under 65, your eligibility can be tied to a qualifying disability. 2 that are automatic eligibility or that grant you automatic eligibility for Medicare would be end-stage renal disease or ALS, Lou Gehrig's disease. Okay, so this is certainly usually the part or the question that we ask about Medicare that causes the most sort of confusion or uncertainty. So we'll spend more time here on what are your options under Medicare. So it helps to understand that all of your options are built on the same foundation. And that foundation is going to be Original Medicare. Now, remembering that Original Medicare is strictly from the federal government, it's comprised of Part A first, which is referred to by name as hospital coverage. So you want to think of that as your inpatient coverage under Original Medicare. Now, most people will not pay a monthly premium for Part A. It's called premium-free Part A. And the reason for that is that your work history of 10 years or 40 quarters will make you eligible for premium-free Part A. And for folks who are married and maybe don't have a work history, but have a work history through marriage or including through a former spouse or deceased spouse, there is an opportunity to be eligible for premium-free Part A. Then there are folks who will be partially eligible, and that comes with a partial premium. So it's not super common. That's something that we can help with if it applies to your situation or someone you know. But mostly folks will have 0 monthly premium for Part A. You've paid ahead for it through your tax-paying history. Under Part A, the services do have some out-of-pocket expense. So the Medicare member under Part A would be responsible for a deductible, which this year, and these amounts in red, the out-of-pocket amounts do change typically annually. This year, that deductible is $1,600 per benefit period. So it's not an annual deductible, but it is tied to a benefit period. And you could have more than one in a year. Not really common, but it could happen. Skilled nursing care has daily copays after the first 20 days. Right now, those copays or that copay is $200 per day. Hospice, variable out of pocket, but pretty minimal, and home care, also variable and minimal. So under Original Medicare, your other half of that is going to be Part B. And this is named medical coverage. And this is something that just drives me crazy because I don't understand why being in the hospital is not also medical. So I don't think it's the most instructive term to call it medical coverage. So the way we try to help people remember which is that Part A is inpatient, Part B is outpatient. So you might see it referred to as medical coverage. It's outpatient care. Now, most people will pay a base premium for Part B, which this year is $164.90 per month. People who qualify for both Medicare and their state's Medicaid program that I mentioned earlier, you can qualify for both. And through your state's Medicaid program, you will have help with your monthly Part B premium. People who have high incomes, on the other hand, will pay more for Part B than that base premium. And there are a few different ranges of income with an associated and additional charge. We'll talk about that in a little bit when we talk more about costs. But most people will pay that base premium of $164.90 per month. That too does tend to change each year. We don't have the new amount for next year, but it's estimated to be about $174 a month next year. Under Part B, your outpatient care, you're going to have your office visits with primary care and specialists. You're going to have urgent care, ambulance. You're going to have outpatient surgery. You're going to have all of your labs and different types of radiological services, durable medical equipment, preventive care, and so forth. Outpatient surgery can happen in a hospital. It's still Part B. The emergency room is at a hospital. That's Part B. So outpatient care is Part B, inpatient is Part A. Under Part B, there is an annual deductible. This year, it is $226. That is always a calendar year deductible. It always starts again on January 1st, even if you're someone who starts Medicare on December 1st. Next year's annual deductible is estimated to be about $240, but we'll see what that amount is when it's been finalized and announced. After meeting the deductible, the Medicare member would be responsible for a 20% cost sharing on claims after that, with Medicare Part B paying at 80%. Now, this is where you really want to pay attention to the potential for runaway costs. So we mentioned something like outpatient surgery. Well, I don't know who's had surgery and maybe looked at that actual statement, the billing, what the price tag was on the surgery before adjustments with your insurance and before the insurance paid. And you can see some really staggering numbers there. So what you don't want is you don't want to be responsible for your 20% under Part B because these amounts, these cost sharing amounts to the Medicare member have no annual and no lifetime maximums. And so you just don't want to be responsible for something that could really be a runaway cost in a bad situation. So if this is our foundation, how do we address these sort of holes in coverage or potential for high out-of-pocket costs? Well, that's where the two main types of Medicare coverage, your two main options for a path through Medicare, are going to occur. So the first one is to keep that Medicare A and B as your primary insurance, and then to add a secondary insurance. And that's what a Medicare supplement or Medigap policy will do. So Medicare supplement, Medigap means the same thing. And these are the policies that are called plan and then a letter name. So right now, it's very common for someone to have a Plan G. Maybe if you've been on Medicare for 5 to 10 years, you might have Plan F. Another plan that's around right now is Plan N. All of these plans are standardized by Medicare. So Medicare determines what Plan G covers, and regardless of which insurance company issues the policy, it will provide the same coverage. And again, these are secondary payers after Medicare A and B pays first. So you're putting someone in place to take care of those out-of-pocket expenses on the previous screen, specifically that potentially really scary 20% under Part B. Now, because your Medicare supplement can only pay after Medicare A or B have paid first, and Medicare A and B did not include prescription drug coverage originally, that's where Part D, think D for drugs, begins to come into the picture. In this first option, you would be adding prescription drug coverage or Part D coverage as a standalone policy. So it's sort of an a la carte model, but that separateness of these two pieces of coverage allows you to make a change to one without changing the other, which can be a nice feature instead of an inconvenience. So Part D coverage, we're going to talk about in more detail in just a moment, but that's your prescription drug coverage. Now, the alternative to this option, option 2, would be to enroll in A and B, but then to also enroll in a Medicare Advantage plan, which is Part C. So those are synonyms. Medicare Advantage and Part C are the same thing. When you enroll in a Medicare Advantage plan, you absolutely must have A and B first, and you must continue to pay for Part B, but you're effectively turning the A and B benefits off, and you're agreeing to be fully covered by that Medicare Advantage plan, which is going to be offered by a private insurance company. You might think of it like a replacement plan for your Medicare. So Medicare is going to pay this private insurance company that's contracted with Medicare and operating under really strict guidelines to cover you to the same level of care that original Medicare would provide. But all of your benefits will come through this private insurance company. Your A and B types of benefits, as well as usually your prescription drug benefits. And these are the plans that are allowed to incorporate some additional benefits that are not covered by original Medicare, such as basic vision, some dental, and some hearing. So, how do you decide which of these options is right for you? So this is where the conversation becomes more personal, because what you're going to need to do is you're going to need to balance your specific health priorities, whether it's current health issues or concerns, or maybe anticipation of the future. You're going to want to balance that with your budget, because there are differences in the costs of each of the two options that we've talked about so far. And it's just a different style of having coverage, and it will have a lot to do with how you balance these two priorities. So the questions that you'll want to be thinking about as you determine what that balance looks like for you are things like, who do you currently see? And if your current doctors are important to you, you want to have that continuity of care and continue to see them. You want to find out if they participate in original Medicare, if they take Medicare A and B. If you're considering a Part C Medicare Advantage plan, it would be really important to make sure they participate with that plan. Medicare Advantage plans are usually a PPO or an HMO. They're typically a managed care plan that will have a network of providers, and your costs will be very tied to use of those network providers. So it's important to look at who your doctors are and what types of plans they take when considering either option. Again, what your current health concerns are and how frequently you typically go to the doctor or have any types of medical procedures or labs or services of other types will have a lot to do with what your costs are. So taking stock of that is important when weighing the two options. Medications. So people are really usually quite surprised to find out how Medicare Part D prescription drug coverage works, and often that it can be more expensive to cover their prescriptions that they have had and have not been particularly expensive on their previous insurance. We're all kind of hearing on the news a lot of talk about Part D, and actually we've been hearing that for a decade or more. So it's a hot topic, and we want to see Medicare prescription drug costs come down. As it stands right now, the prescriptions that you take will have a pretty big impact on what you pay under Medicare, and the plans vary quite a bit. So taking stock of your prescriptions that you take right now is part of this decision making. What you're able to pay each month in a fixed cost is important, and then comparing that to what you're comfortable with as an unexpected cost. So maybe an out-of-pocket cost that's tied to a specific procedure, how much risk you want to have with those variable out-of-pocket costs. And then a lot of Medicare decision making is projecting how you're going to feel in the future and thinking about the decisions that you make now and how that will impact your future choices. What options will remain when you're much older and maybe your health priorities or actual health needs have changed down the road. That's something that's really important to each of us. As we're working with our clients, we do want to help you understand what ramifications for today's choices are in the future. So here's a little side-by-side comparison of these two options, reviewing some of the things that we've touched on so far, just to make sure that the distinctions are clear for everyone. So when you're on Original Medicare A and B, and you have that Medicare supplement, or also known as a Medigap plan, who is your payer of your claims? So your primary payer is Original Medicare, and that Medigap is the secondary payer. So your Medigap has no bearing on who you can see for coverage. They're just the secondary payer. Under your Medicare Advantage plan, remember that plan is replacing all of your A and B benefits. They basically go dormant because you're still paying for Part B, but your claims aren't going to A and B. They're going to that private insurance company that's covering you under the Medicare Advantage plan. Then who can you see? Under Original Medicare, you can see any healthcare provider anywhere in the United States that accepts Medicare, and you do not need referrals to see specialists. Under Medicare Advantage plans, as I said, they are typically HMOs or PPOs. You'll want to stay within the network on an HMO. Going out of the network would mean that you would be paying for that care on your own. With a PPO, you will have lower out-of-pocket amounts if you stay in the network. If you go out of the network for a Medicare PPO, you can see any doctor that takes Medicare, but you may be responsible for higher out-of-pocket costs, as well as perhaps paying the provider and being reimbursed. So Medicare supplements in terms of costs do vary. They are going to vary based on the issuing insurance carrier. So their rating style, whether they rate based on your attained age, your issue age, your community rating is another option. And those are all different rating styles. Different states have some special rules that govern Medicare supplements. So there'll be states where there will be the same rate for everyone who's the same, both genders, as well as of all ages, but it's more typical that you will have varying rates depending on your gender and your age, and it certainly is variable in all cases where you live. So typically you're going to have rates for smaller states will be the same throughout the state for variations in gender and age. Larger states can have regions, like Pennsylvania will have regions or areas, Florida will have regions or areas. So long way to say that Medicare supplement policy costs are very different from person to person. Under the Medicare Advantage plans, you're going to have a fixed premium that will be the same for everyone on that plan in the service area, regardless of age and gender. And then the out-of-pocket costs that you pay will have an annual maximum, the ceiling for which is set by Medicare itself. So you do, as opposed to having just A and B alone, where you have no maximum out-of-pocket cost, with a Medicare Advantage plan, you are putting an out-of-pocket cap. So you know you will not exceed a certain amount each year when you're on a Medicare Advantage plan. I mentioned that with a Medicare supplement, prescription drugs are completely separate. So that's a plan that you would add separately. Typically with Advantage plans, prescription drug or Part D benefits are included. The Medicare supplements do not include some of the additional benefits that I mentioned, but the Advantage plans typically do include some dental, some basic vision, and some hearing benefits. Enrollment is not the same into these two types of coverage. Medicare supplements have more restrictions and more rules, or you might want to think of it as less availability at all times in your life. Your primary time period for enrolling in a Medicare supplement where your health status is not considered at all is when you first enroll in Medicare, specifically Medicare Part B. And then there are some other limited circumstances where you'll be guaranteed acceptance into that Medicare supplement. Apart from that, your eligibility for a Medicare supplement will depend on your health and if you're considered a good risk. The Medicare Advantage plans, however, never have any medical underwriting. Pre-existing conditions are never excluded. There are specific enrollment periods, whether it's your own initial enrollment period or special enrollment period. But then for everyone, the annual enrollment period is an opportunity to enroll in a Medicare Advantage plan, again, without regard to your current health status. Okay, questions. Let's see if I can pull up the chat and see. Unless I'm missing something, I don't see any questions in the chat right now.
Nothing yet.
All right, we'll cruise on ahead and leave more time for questions at the end. Okay, so I've said a couple of times that the prescription drug coverage or Medicare Part D side of Medicare can be challenging. So we do like to spend more time on this, even though we're talking about basics today. There's a lot to learn about Part D, so we're going to dive into it a little bit more here. So Part D under Medicare is going to have some of the same principles, whether your coverage is through a standalone prescription drug plan or whether your Part D coverage is built into a Medicare Advantage plan. So what we'll show you next will be the same in either situation. Sorry, just moving some windows around here on Zoom. All right, so typically your Part D plans are going to have a monthly premium, but that can vary by plan. And when it's part of an Advantage plan, if there's a premium, it will be built into the one total premium for the Advantage plan. They will typically have a deductible. The maximum deductible that's allowed is set by Medicare each year. It's completely separate from your A and B benefits. So we are talking about just a prescription drug coverage deductible. Most medications will have a copay, which would be a fixed amount for that medication, or coinsurance, which would be a percentage of the retail cost as your out-of-pocket amount. However, there's certainly plans and medications where the copay is zero. So it does all depend on the plan and the medication. Pharmacies, all Part D coverage, whether standalone or built into an Advantage plan, will have a mail order option and multiple participating retail pharmacies. There will be standard and network pharmacies. There will be out-of-network pharmacies you absolutely would not want to use. But then there will be standard and preferred and network pharmacies. And at the preferred and network pharmacies, you'll have lower out-of-pocket costs. Typically, actually, we have seen where sometimes it doesn't work out that way. So that's an example of how it really pays to look closely at your plan and costs at different pharmacies. Every Part D program will have a formulary, and the formulary is the list of medications that plan covers. Now, the guidelines for developing a formulary in order to be a contracted Part D plan with Medicare are pretty strict. Medicare sets the rules, and they're not going to contract with a plan that doesn't have the right formulary. That's your protection, your guarantee that any plan that you select will have a minimum of 2 medications that are considered suitable for any ailment or condition that you could have. So you will be prescribed a medication, and either that medication is covered by your plan or something comparable will be. Actually, 2 items comparable. All of the medications on the formulary are going to be classified using a tier structure. And that tier structure is determined by the plan. So typically you're going to see that these plans will have 5 tiers. Some will have a 6th tier that applies to some sort of specific or kind of, a class of medication that's in their own category. Usually we're talking about tier 1 medications being your lowest cost generic medications, and tier 5 being the highest cost specialty medications. And again, each plan determines which tier to assign to a medication. So sometimes we'll have people who'll say, I take 3 tier 4 medications, and we say, let's find a plan where those are tier 3 or tier 2, because your out of pocket will be lower. So the tier doesn't follow the medication. It can vary from plan to plan. And then star ratings. All of these plans are rated annually, and you'll see 1 through 5, with 5 being the highest as a star rating. This is all kind of done by CMS, and you can see this everywhere that the plan is sharing information. So one of the harder things to understand about Medicare Part D is that all of the prescriptions in every plan will go through a 4 coverage stage progression in a calendar year. And the outcome of this is that the consumer's medication often will cost one amount the first time they fill it, another amount the next time, another amount the third time, and so on, to where there's some discomfort maybe on the part of the consumer. I don't know what my out of pocket is going to be this time because of this very kind of opaque coverage stage system that happens behind the scenes. So we want to show you how this works. Certainly something that you can reach out to us for more information about. And if it makes your head hurt a little, you're not alone. This is a little confusing. So that's why we want to share it and sort of try to shed some light on how it works. So the Part D coverage stages always run through a calendar year. Again, it doesn't matter when you start your plan. It could be September, November, December. You're going to have your coverage stages all begin again on January 1st. The first coverage stage is the deductible stage. And everything I'm showing you here is for the 2024 calendar year, since we're so close to the end of 2023. In the deductible stage, you would pay 100% of the retail cost of the medication until you've met your plan's deductible. Now, the maximum deductible for 2024 is $545. Not all plans will have their deductible that high. Some will have a lower deductible. Some plans don't have a deductible. Typically, the lower the deductible or the absence of it would mean a higher premium. There are going to be medications on each plan usually that are exempt from the deductible. So they're so inexpensive that you're just going to go right into the next coverage stage without paying the deductible at that tier. Retail drug costs, that's another important item. The retail drug cost is determined by the relationship between that pharmacy, that plan, and the drug manufacturer. So there's this other entity, the pharmacy benefit manager, that's coming in and kind of coalescing all of those relationships, and the retail drug cost is determined. That can vary quite a bit from one plan to the next, which is why it's so important to really carefully assess your prescription drugs for the plans for the coming year. So the next coverage stage is called initial coverage. And this is the stage that's the simplest, because you're going to have a copay or you're going to have a coinsurance, which is a percentage. So in the initial coverage stage, you're paying that copay or coinsurance until you and the plan together have covered a retail value, that plan's retail value of your medications, of $5,030. So it's not $5,030 out of your pocket. It's you and your plan partnering to reach that value of medication filled. And at that point, you go into the coverage gap, what is commonly known as the donut hole. Now, a decade ago, the donut hole was more challenging, a little more frightening. a decade ago in the donut hole, everyone was paying 50% of the cost of all of their medications. If you reached this threshold, if you reached this coverage stage, not everyone will reach this stage. Now we're down to 25%. So when you reach the coverage gap, you'll be paying, or your co-insurance will be 25% of the retail cost of your medications. An example of how the coverage gap can be a good thing: you might have a medication here in your initial coverage stage where your co-insurance, it's not uncommon to see a co-insurance of 33%, 40%, even 50%. If that's me, if I have that medication and I've been paying 50% of the retail cost, I'm thrilled to go into the coverage gap. So you can see it's not necessarily a good thing or not necessarily a bad thing. It just depends on what your prescriptions are and what they cost that year. Then you're looking at another threshold to meet. Now, this is the what's called the true out-of-pocket limit, and it's $8,000. It's not $8,000 out of your pocket. It's $8,000 of what you've spent and discounts and the plan, and it's just a different number. And when it's calculated that you've reached that amount, you will then go into the catastrophic coverage stage. This is big news for 2024. Formerly, we had a catastrophic coverage stage co-insurance where the Medicare member paid 5% of their retail cost. Now, 5% sounds nice and low unless you have an extremely expensive medication. And we have seen those. Sadly, we've had clients who have gone straight from initial coverage into catastrophic coverage in their first month of a year. And that 5%, we've seen numbers for the year as high as 12,000, 22,000. It used to be really frightening because up until 2024, there has not been a maximum out of pocket for the Medicare member. Now, technically, we don't have a maximum out of pocket until 2025, but we have eliminated the cost sharing in the catastrophic coverage stage. So what this means is that people who take really expensive medications like a life-saving oral chemotherapy or immunotherapy that is really expensive, they'll no longer be responsible for that 5%. Now they'll get through those first 3 coverage stages and they'll have no out-of-pocket for the rest of the calendar year. So as I mentioned, we are going through a lot of changes to the Part D program over the last couple of years, and there are many more changes to come. We will go into this in more detail in our next presentation in a couple of weeks. But some of the changes that you may be familiar with, this change has been in place this past year. We've had the $35 covered insulin, so not all insulin on your plan, but the specific insulins that are participating at $35 a month. And then I did mention in 2025, there will be an official, or there's scheduled to be an official out-of-pocket maximum on Part D coverage of $2,000. So that's a big change from past years. Okay, we almost always have a lot of questions about Part D, and I do see one in the chat. Okay, so we do have a question in the chat about IRMA charges, and I'm going to address that in just a minute. So we'll make sure that we get that question answered at that time. And I don't see anything else in the chat, so we'll just cruise on ahead. I think I went too fast. Okay, so next let's talk about the different enrollment periods. And these are going to vary depending on your circumstances. So first, let's talk about the person who is turning 65 and not covered by employer coverage, either theirs or their spouses. So if that's you, then you would be enrolling in Medicare during what's called your initial enrollment period or your IEP. I'll show you a slide in just a moment that makes it really easy to determine what your IEP is. So during your initial enrollment period, if you are someone who needs to fully enroll in Medicare at age 65 because you don't have that employer group plan, you are not going to automatically be enrolled unless you are receiving some type of Social Security benefit. So if you are not, then you're going to have to reach out and initiate enrollment into both parts A and B. Again, going back to our path process, we help with that. We help with that all the time. And you want to start that process early because you need the foundation of A and B before you can make any of those other choices to build on it. So that's your potentially C Advantage plan or standalone Part D and Medigap. We need time after getting A and B in place to add those pieces. So it's a good idea to start at the beginning of your initial enrollment period. Late enrollment, missing that initial enrollment period, if you're supposed to be enrolling at that time, can cause a delay in your Medicare coverage. You can't enroll at just any point, and there are potential penalties depending on how long you go without Medicare. Now, if you are turning 65 and you are covered by an employer plan, whether yours or your spouse's, and that employer plan is from an employer with 20 or more employees, then that is typically what's considered creditable coverage. And you usually receive a letter annually saying that your coverage is creditable for Medicare. What that means is that you can stay on that employer plan indefinitely and postpone your Medicare enrollment until you decide you're ready to enroll in Medicare, which could mean you or your spouse are retiring, or maybe Medicare is going to be less expensive, or maybe you like the idea of the Medicare coverage more than whatever your employer's group plan is. You can keep working and go on Medicare. You're in the driver's seat. And you would then enroll in Medicare using what's called a special enrollment period. You get to set the parameters of that. You decide when you want to start Medicare as long as you're on that creditable employer plan. So using a special enrollment period, we're going to talk to you to make sure that you are either, if you're enrolled in a health savings account, making contributions to that, we'll have you hold off and not enroll in Part A. But if you're not, it's smart to get Part A even while you're still working. Remember, there's typically no monthly cost. There's no downside as long as you are not contributing to an HSA. If you are, you don't want Part A. That's both considered, a deduction and a federal program. It's like double dipping. You have to keep them separate. So when you're ready to make the transition from employer coverage to Medicare, you can reach out to us. This is something else we do all the time. We provide the paperwork that you'll need to take to your employer, walk you through the process of enrolling online, and then hopefully, we don't always have a buffer of a couple of months to work with, but we like to have that so that we can then assess your needs for additional coverage and help you with that so that everything is lined up to begin when the employer coverage is ending. And one thing that's a big mistake, unfortunately, a lot of people aren't told this, and if they don't read this or hear about it, it's a common mistake. And that is to believe that going on to COBRA coverage from an employer plan is the same as being on an employer plan, and it's not at all. COBRA coverage is not primary coverage once you're over 65. So if you're transitioning from an employer plan over to COBRA, there may be reasons to do that, but you absolutely will need to have A and B, or that COBRA coverage does not have to pay your claims. And they might not tell you that until a claim comes in. And then they say, oh, wait, this goes to Medicare first. And you say, well, I didn't know that, and I don't have Medicare. And they say, sorry. So if you know someone who is in danger of making that mistake, please warn them. We hate to see this, but COBRA is not creditable for Medicare over age 65. So folks who are going to qualify for Medicare when they're under 65, if you are receiving Social Security disability, you will qualify for Medicare automatically and be automatically enrolled on your 24th month of Social Security disability. That first time period of qualifying is considered your first initial enrollment period, or your IEP 1. Later on down the road, when you turn 65, you'll have a second initial enrollment period, or IEP 2, and that's an awesome opportunity to secure different coverage than you had in your first IEP. We help people who fall into this circumstance. We want to make sure that they don't miss that second IEP, because your coverage needs under Medicare when you're under 65 are going to be different than when you're over 65, and the plan options that are available to you will also be different. So you'll want to just reach out to us for more help with that situation. And then this is just a graphic of what your initial enrollment period looks like. So everyone has a 7-month-long initial enrollment period. It begins the first day of the month that is 3 months before your birth month. And that's even if your birthday is on the last day of the month. So October 31st birthday, they have all of June, all of July, and all of August, those first 3 months, then the month of October, and then they have 3 months after that. The one exception would be someone whose birthday is the first of the month. You will have everything bumped up 1 month earlier, and your initial enrollment period would start 1 month earlier. We do like to see people who need to enroll in this time frame do it at the first month of this time frame. Waiting on Social Security to process your enrollment is unpredictable. We've seen people enrolled within a week. We've seen people work at it for 6 to 7 weeks or more. So it always pays to start early and then have a less stressful path through this time period. When you enroll 3 months before your birth month, your coverage is not going to begin any earlier than the first day of your birth month. So there's no like, oh, I'm not ready for it to start yet. It's not going to start until the first day of your birth month. So why does all of this matter? Well, there are all of these different penalties tied to making mistakes on your enrollment period. So for example, when you are late enrolling for Part B, whether you missed your initial enrollment period or you mistimed your special enrollment period, or maybe you stayed on COBRA for too long, if you miss your chance to sign up for Part B, you can have a 10% penalty for every full 12-month period that you didn't have Part B. That accumulates and then it lasts for the rest of your life that you're enrolled in Medicare. I actually had someone reach out to us for the first time who was 75 and had not enrolled in Part B. And he was looking at an enormous penalty. So that's something that we hate to see. It does add up. It's very unforgiving. Other penalties that, or time periods to be aware of, really, I mentioned this before, your first 6 months of Medicare Part B is a key time period for securing a Medicare supplement or Medigap policy, if that is how you would like to be covered. That's your best opportunity to do that without any issues and no health conditions coming into consideration. Why wouldn't we have a different enrollment time period for Part C and Part D? Of course we do. So 63 days or 2 months is generally what you have as an opportunity to enroll in an Advantage plan or a standalone prescription drug plan during your initial enrollment period, and also with most special enrollment periods. And then why would we not have a different penalty for Part D than we have for Part B? Under Part D, the penalty accumulates on a monthly basis at a rate of 1% per month. You cannot enroll in Part D at just any time of the year if you don't enroll when you're supposed to. You have to wait. So that's how sometimes people wind up with a penalty, is making the mistake of thinking that they can enroll at any time. The penalty, once it's accumulated, you do pay that every month for the rest of your life that you're enrolled in a Part D plan. So our objective is always to talk to people before they run into any scenario where any penalty might be at play, or if there is a penalty, if we can figure out a way around it or minimizing it, we like to do that. It's a nice challenge. Okay, so what does it cost? So we've touched on these, and we're really only talking about specifically the things that are going to be the same for everyone. We talked about the cost sharing amounts that original Medicare Parts A and B leave to the Medicare member. We talked about the premium for Part B. The deductible and copays and coinsurance are those A and B cost sharing amounts. I hope that I emphasized enough that there's no annual or lifetime maximum on that. And then other potential expenses would be a monthly premium for a Medigap or Medicare supplement, potentially for an Advantage plan, possibly a monthly premium for a prescription drug plan. You might have a deductible and out of pocket with your prescription drugs. If you enroll in original Medicare and a Medicare supplement, dental, vision, and hearing costs could be covered by additional plans, standalone plans, or you could self-pay. And then IRMA. So this pertains to the question that was in the chat, and we will look here at our slide that shows the current IRMA costs. So IRMA is an acronym. It's the Income Related Monthly Adjustment Amount. And these are amounts that are assigned to people who have higher than average incomes. So this is something that we spend a lot of time usually introducing this to our clients and figuring out where they're going to fall on this chart. And then as the person in the chat mentioned, things happen and your income changes. Because this is an automated process, Social Security, when you enroll in Medicare, takes a look at your income from 2 calendar years back. They're literally just accessing that tax return always from 2 calendar years back. And this adjusts every year that you're on Medicare. So if a life-changing event has occurred during that time period, there is an appeal process. Now, not all life-changing events qualify, but retirement or even reduction in hours are 2 of the 8 events that qualify. And while you will read or kind of see on the paperwork that they ask you to apply at certain times, we have seen people put together an appeal to these additional amounts and had success if you just really provide all of the information that's required. And we tell people to go in person to Social Security to turn in this form and say, hey, life has changed since the year that you're looking at to determine what I pay for Medicare. And I want to show you my new estimated income and get these amounts reduced. About 8% of Medicare members now pay these higher than average amounts. And so this top row is the base premium. And then each of these rows would be a higher than average amount. Higher incomes for higher Medicare premiums. Okay, so a few things as we wrap up, and I want to make sure I get to our other question here. So visit our website now, mpgroup.org. If you go to Medicare portal, it will direct you to MP Group, and we have all kinds of resources on there. Our site is purely educational, so we have a live chat if you want to connect to someone, but mostly we're just trying to provide resources that will help answer your Medicare questions. We have a quarterly newsletter that we send our clients, and we're happy to send it to anyone who's interested in what we think are important Medicare updates. Other resources, so as your Medicare life begins and progresses, you'll want to get to know the Social Security website really well, and the Medicare.gov website, which is a separate website. It's a fantastic website. Also an app that helps you determine what's covered by Medicare. It's a symbol right down there at the bottom of the screen on the right. It's called What's Covered. It's run by Medicare. It can be really handy when you're in a doctor's office and trying to look up whether something that is being discussed would be covered by Medicare. That's your tool right there. So as Sarah, oops, what did I do there? As Sarah mentioned, we have gone through this name change recently. So Medicare portal is now MP Group. Everything else is staying the same. And that's my contact information. Let me hit this one other question. Okay, so so this is a really good question. When you're enrolled in a Medicare supplement, that supplement is going to continue year after year unless you actually cancel or stop paying the premium. So often people will ask this question, if I'm in a plan and I'm happy with it, do I need to do anything during the annual enrollment period? And the answer is no. If you're happy with your coverage, no action is required. The same thing is actually true with a Medicare Advantage plan and a Part D plan. So you're going to be in the plans you're in unless you cancel them or stop paying the premiums or you change the plan. Anyone have any questions they wanted to say out loud? And I'm happy to stay on for a few more minutes. I know we're at our time and then in the next minute, but I'm happy to stay on for a couple more minutes if we had anyone who wanted to unmute. This last question was really a good segue into the annual enrollment period presentation in a couple of weeks. We will get into all the messaging that you get this time of year and what it actually means. We're going to break that down for you. And so the question then that just came in is, so who are the folks who do have to do something in the enrollment? That would be someone who needs to enroll in something because maybe they don't have a plan right now, or maybe they're in a plan that they're not happy with, or maybe they've been in a plan that covers their medication, but they got a notice from the plan that it will no longer be covered next year. Those are all reasons to make a change at this time. If those reasons don't apply to you, you can tune out all that messaging and focus on things that are more exciting than Medicare. Thanks, Nancy. Well, so appreciate having the opportunity to talk to everyone today, and certainly welcome additional questions, and reach out and let us know how we can help you, and hope to see a lot of folks in a couple of weeks.
Thanks so much, Emily. And thank you to everybody that attended today. If you have additional questions about your Medicare options, please do reach out to Emily. She is just a wealth of knowledge. And of course, follow up with your VLP advisor. And then lastly, don't forget to join us later this month on the 18th for the second Medicare webinar. In addition to that, we're actually hosting, we have lots of webinars this month. We have one on fixed income next week on October 11th. So a whole lot coming up. Thank you again for everyone for joining. Big thank you to Emily for presenting. We hope you have an enjoyable rest of the week.
Thank you so much. Take care.